Everyone, welcome to our video. Today, we are going to talk about a common illness that many people, especially parents, might have heard of. The illness is called hand, foot and mouth disease, or HFMD. If you have kids or you work in environments like daycare centers or schools, this is something you'll want to know about. In this video, we'll dive into what HFMD is, how it spreads, and most importantly, who's are at risk and how you can help to prevent it. So, if you are curious about this viral infection and how to keep your loved ones safe, keep watching this video until the end. So, what is HFMD? HFMD is a viral infection that causes a rash or blisters on the hands and feet, as well as in or around the mouth. There are two types of viruses that can cause HFMD, which is Coxsackie virus A16 and Coxsackie virus A6, which belong to the group of viruses that called enteroviruses. The symptoms of HFMD vary depending on the virus. HFMD mainly affects children under the age of 10, but can also affect adolescents. It spreads easily from one person to another, and it is also possible to contract the virus more than once, but the symptoms will be less severe. HFMD is not related to the foot and mouth disease that is found in animals.
Now I'm going to talk about the sign and symptom of HFMD. Usually the sign and symptom of HFMD appear 3 to 6 days after the exposure, which is the incubation period. The sign and symptom of HFMD divided to 3 categories, which is firstly the early symptoms, secondly the main symptoms, and lastly the severe symptoms for rare cases. The symptom of HFMD occur 1 to 2 days before the rash appears. The symptoms are fever that can be mild to moderate, sore throat, fatigue or feeling unwell, and lastly, loss of appetite. Then there are several main symptoms including painful mouth sores, which is known as herpangina. Herpangina cause red spots that turn into ulcers that can be found on gums, tongue, inside cheeks and throat. Next, skin rash. Skin rash is flat or raised red spots that sometimes come with blisters. They are common on palms, soles, buttocks and legs. In most cases, they are not itchy. And lastly, severe symptoms which occur in rare cases. These symptoms can cause dehydration due to painful swallowing, high fever lasting more than 3 days, and neurological complication only if caused by enterovirus 71.
So there are 4 ways on how HFMD spread. Number 1 is through droplets. Number 2 is close contact with an infected person. Number 3 is contact with feces or poop. And last but not least is contaminated places. The first and the most common ways HFMD spread is through tiny droplets in the air. So when an infected person coughs, sneezes or even talks, they let the tiny viruses spread into the air. And when someone nearby breathes them in, they will easily catch the virus and get HFMD. So that is why covering your mouth while you sneeze or cough is very important. And don't forget to wash your hand afterwards. So the second one is close contact with an infected person. If you hug, kiss, or maybe just holding hands with an infected person, the virus can be easily transferred from the infected person to the other person. The virus also can be spread through sharing cups, utensils, or even toys. So this is why parents must be extra alert when handling young children who may have the virus but not showing the symptom yet. The third one is contact with feces or poop. This one might sound surprising, but HFMD can also spread through contact with an infected person's poop. As an example, if a parents want to change their young children's or baby diapers and doesn't want to wash their hand properly, the virus cannot be completely eradicated. Thus, the virus can be transferred or spread to any other objects or even food. So please always wash your hands thoroughly after changing diapers or using the restroom to avoid the spread of the virus. And last but not least, number 4, which is contaminated surface, object or places. Because HFMD can survive on any surface like doorknobs, toys and tables. So if someone basically touches an object with the virus on it and then touches their face, especially their eyes, mouth or nose, the virus can enter their body and causes infection. And to overcome it, just do some regular cleaning and disinfecting of frequently touched surface.
You have heard my friend's explanation about what is HFMD, signs and symptoms, and also how it spread. Now, I'm going to share with you about how to prevent HFMD from spreading. The first and most important step to prevent HFMD is proper hand hygiene. Always wash your hand with soap and water for at least 20 seconds, especially after using the restroom, before eating, and after coming in contact with someone who is sick. HFMD spread through direct contact with saliva, nasal discharge or blister. If someone is infected, avoid close contact such as hugging or sharing utensils to prevent the virus from spreading. The virus can survive on surfaces and objects. We have to regularly disinfect commonly touched areas like toys, door handle and also table to keep the germs away. Next, always cover your mouth and nose when coughing or sneezing to prevent the virus from spreading, and don't forget to throw away the used tissue immediately. If your child has a fever, rash or mouth sores, let them rest at home until they fully recover. This will help to stop the virus from spreading in schools and also daycare center. By following these simple steps such as washing hands, avoiding close contact, covering cough and staying at home when sick, we can prevent HFMD and keep our family safe.
Now that we have learned about HFMD, its symptoms, and how it spreads, let's talk about something just as important, which is how to treat and recover from it. HFMD doesn't have a specific cure because it's caused by a virus, but most cases are mild and go away on their own within 7 to 10 days. The key to recovery is managing symptoms and preventing complications. First of all, to relieve fever and pain, doctors always recommend paracetamol or ibuprofen. This helps to reduce discomfort caused by fever, mouth sores, and skin rashes. Next, staying hydrated is very important, especially for children who may avoid drinking because of painful mouth ulcers. Cool fluids like water, milk, or diluted fruit juices can help. Soft foods like porridge or yogurt are also good choices, while spicy and acidic foods should be avoided. Other than that, plenty of rest is needed to allow the body to fight off the virus. Parents and caregivers should make sure the affected person stays comfortable and gets enough sleeps. Besides that, even during recovery, it's important to prevent spreading HFMD to others. This means practicing good hygiene, like frequent hand washing, disinfecting shared items, and avoiding close contact with others until fully recovered. HFMD is usually mild, but in some cases, complications can occur. Seek medical help if there are symptoms like severe dehydration, such as no urination, dry mouth, and dizziness. Second, if you're having fever lasting more than 3 days. And last one, if you're having difficulty breathing or swallowing. These could be signs of a more serious infection, so don't ignore them. With proper care, most people recover fully within a week or so and can return to normal activities. The best way to stay healthy is to manage symptoms early and prevent the spread of the virus. Take care and stay safe.